I've known Senator Whitehouse for 15 years. Shortly after we opened the new Hewlettar Hospice Center on North Main Street in Providence back in 2009, he was one of our first distinguished guests to visit, to tour, and to talk with our patients and their families. Senator Whitehouse looks at things from a very broad policy perspective, but he always keeps his focus on how different approaches can help Rhode Islanders. I'm also the vice chair of the National Partnership for Healthcare and Hospice Innovation, a national group of leading nonprofit hospice and palliative care organizations from all over the country. And in my work with this group, I have become even more aware of just how highly regarded Senator Whitehouse is within the halls of Congress. He is the go-to senator for all issues related to care at the end of life, and I am just so grateful for his passion and the seriousness with which he takes our work in hospice and palliative care.
I had the opportunity to work with Senator Whitehouse back in 1999 through his campaign for Attorney General in 1998 as he was out talking to Rhode Islanders. One of the things that people brought up was some of the difficulties they had as their families sought end-of-life care. It was mentioned that sometimes their wishes were not honored. They got care that they really didn't want. So when he took office, one of the first things he did was to establish a task force to improve end-of-life care. Now I have to say that was unique. There were not other attorney generals in the country looking at this.
I'm interested in end-of-life care because it's so important in a family's history. When my father died, he had nursing care. He lived out in rural Virginia, so there wasn't a hospice per se, but there were nurses who did that, who came and saw to his comfort and well-being through his final days, and it made such a big difference.
Well, I just think he's incredibly effective. He brings the people together who need to be there, basically all of the stakeholders. For example, we now have what's called medical orders for life-sustaining treatment. In this case, it was very important that we get the diocese on board with this for this to be able to pass, and the diocese absolutely was. And I think Senator Whitehouse played a very important role in that.
We've done a lot of work throughout Rhode Island, I think. It's been a good set of changes. Well, I wish you well.
Thank you so much.
You're in good hands here.
Okay. Yes, this place has been out.
Hope Health was doing hospice care before it was cool. When I visit, you see a first-rate facility, quiet and respectful, with families gathered, doing one of the most intimate and important things that families gather to do, which is to say a farewell and express their love for a departing family member.
Sometimes we get frustrated that we complain that, well, government doesn't work, things don't happen, but I think Senator Whitehouse gets things done. He's been very effective.
There is something uniquely raw and vulnerable about a family for whom a parent or a grandparent has been lost. Worse still, for many, a child has been lost. To know that in that important moment, the family felt supported, protected, treated with dignity. The motivation for me is how very deeply I believe families feel this moment.